Comparison of conservative care versus surgery after anterior shoulder dislocation, a systematic review and meta-analysis by Kelly Warner and Olivia Vanderveer. Recurrent shoulder instability is a common complication following an anterior shoulder dislocation. This can be treated either with surgery or conservative care, both usually involving a period of immobilization. Our research question was, as compared to surgery, is conservative treatment as effective as surgical treatment at improving stability in individuals after acute first-time anterior shoulder dislocation? So throughout our systematic review, we used 3 search engines, PubMed, Medline, and Embase. Our inclusion criteria was that it had to be a first-time occurrence of anterior shoulder dislocation, and it had to compare only surgery to non-surgical treatment. We excluded studies where the subjects in the conservative care only group chose to have surgery while participating in the study. After we got all of our articles, we input the data into CMA and calculated effect sizes as an odds ratio using random effects model. Then we ran subgroup analyses and meta-regressions on our moderator variables. Based on the search criteria, 14 studies were chosen to be included in our meta-analysis. The information presented in Table 1 is representative of the subjects included within the studies who experienced a first-time acute anterior shoulder dislocation. There is a variety in the types of surgery performed between the studies. However, a majority of them had been cart repairs.
Figure 2 shows that a significant large effect was found with the conservative care group, 10.8 times more likely to redislocate compared to the surgery group. Because of considerable heterogeneity, subgroup analyses and regressions were run on 6 moderator variables listed in Table 2 and 3. Studies involving older subjects had less recurrent dislocations compared to those with younger subjects. This is assumed to be because younger subjects tend to be more active and involved in sports. A greater amount of activity provides them with more opportunities to redislocate, compared to older adults who may be less physically active. Our findings reveal that surgery may be a necessary step in the recovery from an acute anterior shoulder dislocation until inconsistencies in the conservative care treatment can be decided upon. We would like to thank Dr. Morelli and Dr. Warren for their technical advice throughout our project.